Video ini direkam pada Sabtu 9 Januari sesuai dengan informasi yang tersedia pada waktu tersebut.
Hai semuanya, jadi hari ini gue pengen ngobrol sama teman gue Hardian yang ada di Amerika. Nah, dia itu sekarang graduate student di Arizona State. Dia tinggalnya di Phoenix di Arizona, and dia itu udah divaksin sama COVID-19 vaksin. So I kind of wanna just ngobrol-ngobrol aja santai sama dia buat lebih tahu lagi lah ya experience dia vaksin di sana gimana. Dan sebelum kita mulai video ini, tolong pencet tombol subscribe di bawah. Dan kalau misalnya masih ada pertanyaan yang belum dibahas di video ini, bisa komen aja di bawah dan mungkin kita bakal bikin part 2 with your questions. Nah, oke, Har. Hi, now you can introduce yourself.
Hai semuanya, ya kayak Beth bilang kan, saya ini graduate student or doctoral student, I guess, in clinical psychology. So I'm doing my PhD. I'm a third year, so I have 3 more years to go, I think.
3 more years?
Gua dulu
okay.
Di Indo, 3 more years. Di Indo, gua dari Medan, Sumatera Utara. So met Lisbeth at UCLA. We were both psychology degree. And then I stayed in the States, and she went home. But yeah, so that's me.
Yap, Hardian tuh kayaknya dari antara kita bertiga yang ambil psikologi dulu di UCLA yang paling menggunakan gelar psikologinya ya, sampai PhD ke clinical psychology. And you specialize in children ya, Har ya? Is it?
In child, kayak psikologi buat anak kecil gitu, anak kecil and
child
adolescent,
psychology.
teenager.
Umur berapa tuh berarti?
Child adolescent psychology. I would say like 6 to 17 is the age that I usually work
6 to 17.
with. Yeah, clinical psychology-nya kayak 5 to 6 years, and then there's a +1 internship. So that's fully just clinical work. Jadi kayak di rumah sakit gitu loh, kayak di psychiatric unit atau gimana-gimana.
Dan jadi lu udah divaksin COVID kan ya, Har ya, kemarin ini?
Ya, gua dapat vaksin the Monday after Christmas. So Desember 28 gua vaksin pertama, dan karena bakal ada 2 dosis. Jadi vaksin kedua itu 2 minggu lagi, Januari 18. Gua dapat vaksin itu gara-gara kan gua clinical psychology kan. i.e. I'm a student therapist in training. So according to the state of Arizona, I qualify because I'm a healthcare worker, basically. Jadi kerjanya sama pasien gitu, ada ketemu orang. Jadi di Arizona itu mereka ada county gua, Maricopa County. Itu mereka ada buat website, ada kayak COVID-19 pre-screening survey gitu buat vaksin. Jadi gue kayak answered all the questions, and turns out I qualify for the first phase. And a lot of other clinical psychology graduate students in my program as well qualify. Dan gue juga tahu kayak ada like nursing students also qualify, counseling students also qualify, karena mereka juga ada ketemu pasien gitu loh. Jadi kita termasuk yang phase 1A. Jadi setelah gue isi itu, gue dapat message itu kayak, ntar pas ada appointment open kita bakalan message lo atau email lo. Terus 4 hari kemudian gue dapat email buat suruh sama text message gitu, SMS, buat gue kayak suruh schedule appointment. So and that also varies based on where you work, I guess. Jadi kayak yang gue punya itu appointmentnya langsung 2 appointment. Jadi kayak yang pertama sama yang kedua langsung sekalian. Tapi ada teman-teman gue yang lain itu kayak cuman appointment 1 vaksin, entar baru bisa appointment yang kedua. Jadi kayak beda-beda gitu loh, kayak semua tergantung lokasi, tergantung hospital gitu.
Nah, berarti dari lu dikirimin SMS sama email to your first vaccination, itu lu dapat berapa lama tuh? And is that like the fastest schedule that you could get?
Yeah, so if I remember correctly, I think it was a week after. So there's an opening starting a week after. Jadi, yeah, and it's also like around Christmas. So maybe, like maybe it's better now, but because like people are on breaks and stuff. But yeah, I just picked like the one that I can go like that works well with my schedule at least. Yeah, so it was like pretty quick. It does really depend on the states though. Jadi kayak yang gue tahu kayak California kan kayak ramai banget kan. Jadi kayak temen gue yang kayak di counseling student gitu kayak UCLA katanya kayak bilang mereka nggak qualify gitu. At least for phase 1A.
Okay.
So yeah, so it really depends on the state, and also and that's true. Like the kayak vaccinationnya itu, disseminationnya itu nggak ada kayak federal level loh, kayak nggak ada ya US government suruh orang ini sistemnya, enggak, kayak tergantung state by state and county by county.
Depends on the
kayak
state
gimana
ya.
mereka mau urusnya, iya. Kayak terserah mereka mau gimana urus gitu loh. Jadi so I can only talk about what happened in Arizona. We also have like one of the highest cases in the world apparently, like the growth cases. There's a news article about that a couple days ago. So it's good that we are getting vaccinated. Yeah, so and they are already moving to phase 1B now. Jadi ada 3 phases kan, phase 1, phase 2, phase 3. Tapi phase 1 itu dibagi jadi phase 1A, 1B, 1C. Jadi Arizona sebenarnya udah maju ke 1B. Jadi udah lebih banyak lagi orang yang bisa qualify buat divaksinasi. Jadi 1B itu kayak guru-guru lah.
Kalau guru-guru apakah mereka masih ketemu in person?
Yes, depending on the school. Jadi ada sekolah distrik yang kayak masih ketemu in person. And there's a lot of, like controversy to say the very least about whether that's the right thing to do. I think both sides make a good point, right? But hopefully the vaccine kind of like help with like keeping the teachers safe as well as keeping the students safe.
I see.
Tapi jadi itu juga tergantung sekolah. Jadi ada sekolah yang fully online, ada sekolah yang masih ketemu kayak face to face. Jadi so it's really tricky to say the least. Karena nggak ada yang kayak bilang harus kayak gini, harus kayak gitu. At least in Arizona.
Iya sih. Soalnya kalau di Amerika emang bener-bener state by state udah kayak function kayak just like a different kind of kayak udah different country kali ya, maksudnya yang kayak ngurus juga. Amerika it's like so many different like political levels there gitu.
Exactly, ada state level kan, sama ada federal level. Jadi in a way, at least the COVID responses are not centralized, i.e. Not a lot comes from federal level. Like each state is for themselves, I guess. So it has been kind of crazy, and there are a lot. I mean, I feel like the world who follows the news in America probably knows why it was like that. To put it simply, it's kind of messy.
I was like,
But hopefully it will change soon in a couple of weeks when not we, but the country gets a new president.
Tapi kalau misalnya di Arizonanya sendiri gimana, Har? Kayak what's happening, kayak tadi kan lo bilang kayak Arizona salah satu yang kayak paling tinggi gitu kan, maksudnya di dunia juga, kayak how are people responding there? Terus kayak orang-orang tuh di sana pakai masker nggak sih? Kayak what's happening gitu?
It is pretty similar to Indo kalau gua nggak dengar kayak dari papa mama gitu kan, kayak ada orang yang pakai masker tapi juga banyak orang yang enggak gitu loh. Kebanyakan kalau gua pergi ke tempat-tempat itu kayak tergantung restoran sendiri juga, kayak mereka ada yang mandate mask, ada yang nggak mandate mask. Kebanyakan sih orang pakai sih, kalau gua kayak ada pergi ke tempat-tempat gitu kan, kayak pick up makanan lah atau pick up apaan gitu kan, kayak gue ada lihat sih kayak kebanyakan orang sih ada pakai mask, tapi kayak kalau gue ke internet gampang banget gitu loh, kayak cari ada video orang yang kayak marah kalau dipaksa pakai mask gitu. Rekomendasinya kan juga memang suruh pakai mask kan, tapi again yang federal governmentnya itu nggak kayak paksa orang harus pakai gitu loh. Dan juga jadi again kayak tergantung state-nya gitu. Kayak I think Arizona
I see.
ada kayak fine gitu buat
Oh.
orang yang nggak pakai mask. Tapi I don't think it's enforced or it's not as highly enforced as it should be. As of right now, kayak businesses are open, kayak restaurants are open. You can actually sit inside a restaurant to eat. But some people don't do that. Some people do that. So again, it's just people's right to do so, right? The government is not forcing anyone not to go. Jadi tergantung orang-orang lah. At the very end of the day.
Tapi kalau misalnya di you can dine in gitu tuh ada restrictionnya gitu nggak sih, Har? Kalau misalnya di Indonesia kan misalnya kayak lagi PSBB gitu, kayak we can do like 25%, there's like a limit to it. Kalau di Arizona gimana?
My understanding is that it's up to the
I see.
businesses. There are some times where the government is like, businesses should limit capacity to a certain percent, but I don't think that applies now. I think that like expires already. Yeah, so it's always like an order that the governor sent out. I don't think he has sent a recent order.
Okay.
So again, it's based on the restaurant, so up to them. Yeah, but I think some restaurants are like some places that I go to, they're like just takeout, like they don't do dine in, but some restaurants do dine in. And again, some people like limit capacity, like for a store for example, kayak kalau udah ada 10 orang di toko jangan masuk gitu. It's like I don't know if they actually enforce that rule, but again, it's up to the person too. Sometimes I see like, oh, like these people is in front of the door because there's this rule, so they are following what the store said. But some people don't. So it's always like a tricky thing.
Kalau misalnya dari kayak cara ngecek COVID tuh di Arizona gimana, Har? Misalnya kayak, is it easy to get like tested, to get swabs? Is it like free? How does the government juga kayak support gitu buat orang-orang lebih kayak aware?
The testing is actually great now. So federally, so there's the Families First Coronavirus Response Act. It actually ensured that everyone can get tested, including uninsured
that's good.
people, for free. I think there's this misunderstanding that I've been gathering is that some people don't actually know that it's like totally free, even if you don't have health insurance. So that's a thing that they should know.
Okay.
So it's free, at least in Phoenix, Arizona, or Tempe, Arizona, Arizona State University. So my university, so the Biodesign building actually worked with the government, and they actually was one of the first people here actually that developed their own test kit, like the rapid testing with the saliva. So for us ASU students, it has been very easy, to say the least. We just go to our health portal, do an appointment, and then we just go. Yeah, there's an in-person option. There's also the drive-through option. I always do the drive-through because I feel safer anyway. And it's easy. They just give you like the saliva thing, and then you park somewhere, and then you spit to the tube, and then you hand them off, and then you get the result in 2 to 3 days on average.
Okay. Jadi Har, by the way, gimana kan tadi lu udah cerita kayak lu bisa dapat vaksinnya gimana gitu kan, kayak kalau misalnya di Amerika, if I'm not mistaken, you can choose ya either like Pfizer or Moderna, and then which one did you choose, terus kayak harganya tuh berapa, what's your consideration?
Okay, yeah. So I don't get to choose actually. Gua dapat Pfizer. Yeah.
Oh, okay.
I think it really depends. I have not heard anyone that gets to choose yet. But also because we were like the early on people. Kalau lu ingat timeline-nya vaksin di Amerika itu Pfizer duluan, terus kayak in 1 or 2 weeks baru Moderna di approve. So there's that so I was in between where like it's a Pfizer only. So I got the Pfizer one.
I see.
The vaccination is free, so that's good. So I don't actually know the actual cost because it's free. I just sign up and I got it. Tergantung juga kayak lokasi lu di mana. Karena kata yang gua baca itu kayak Pfizer itu freezing point-nya itu beneran harus kayak specialized freezer. Kayak I think it's -70 Celsius.
I see.
Versus like Moderna can be like on a like regular freezer, like -20. Jadi gara-gara cara maintain the vialsnya itu beda. Katanya sih kayak yang kota besar itu bakalan lebih banyak Pfizer dan kota kecil itu lebih banyak Moderna karena Pfizer perlu equipment yang lebih mahal versus yang kayak the rural areas gitu-gitu atau kayak yang lebih under resourced, let's say.
Kalau nanti berarti di Amerika vaccines would be free for everybody regardless of like insurance status atau itu beda lagi?
Yes, it is free.
Gitu.
Yes, even for the uninsured.
And is there any like restrictions gitu to the vaccines? Misalnya kayak Pfizer, siapa aja sih yang boleh dapat? Except the timeline gitu ya, maksudnya kayak from age and stuff.
I think Pfizer is 16 to like the upper limit. I think is 80 something. I think Moderna is the 18 something.
Okay.
So 18 plus. So yang anak-anak kecil itu masih belum bisa gitu. Kayak karena mereka testingnya kayak researchnya itu nggak sama anak kecil.
Mereka juga baru bisa safely say for like 18 plus gitu ya. Iya sama sih kayak yang Sinovac di Indonesia itu juga kayak 18 to like 60.
I think there were some news about like some people who get like some allergic reaction. So as a side effect. So until the night, lengan gue itu kayak kalau gue pegang itu kayak sakit gitu, kayak otherwise I'm fine. Kayak sore gitu aja, kayak kalau gue pegang itu kayak sore gitu.
Pegel gitu kan, pegel gitu kan. Ya.
Oh, to monitor for the like potential allergic reaction. So it's like a drive-through to get the vaccine. There's this sign up to like validate if you're a healthcare worker or not. And then you go there. There's gonna be like a couple spots for people with computers. Again, this is different for each places, right? But I'm just gonna share my site. Jadi kayak ada drive-thru gitu, kayak cium gitu. Jadi kayak yang line pertama itu kayak kita masuk kan, terus kayak itu dia verify identity, terus kita kayak disuruh tulis information, terus ada beberapa kayak tenda-tenda gitu loh, kayak ada orang yang di komputer kayak buat lihat lu nama lu apa gitu buat verify, terus tanya kayak ini some questions, kayaknya mereka ini buat make sure kayak am I like at high risk for like kayak allergic reaction or anything like that, or maybe I shouldn't get a vaccine. Jadi ada kayak pre-screen question gitu. It's just like 4 question. Terus kita kayak ke second lane. That's when I got like the shot. So there's gonna be a couple of tenda gitu loh, kayak ada nurses in training yang buat suntik kita. Terus kita pull over buat stop for 15 minutes. So we need to wait for 15 minutes. So it's like this orderly line. Kayak ada beberapa lane buat kita kayak tunggu, terus car in front of us go, then we pull over to the stop sign gitu-gitu until 15 minutes has passed. Itu buat monitor kalau lu ada allergic reaction atau enggak. So and then you just leave. So it's very easy.
Terus kayak lo di follow up gitu nggak sih habis vaksin, misalnya kayak selain misalnya nanti kayak your schedule for your next top up, lo di follow up lagi gitu nggak, misalnya kayak are you experiencing any like side effects, if you do kayak what do you do gitu?
I didn't get any follow up,
I see.
So I don't actually know if people are trying to do that. It sounds like a great idea,
Hire me,
especially for research purposes. But at least my side don't. So I'm just waiting for my second dose now. Usually it's 3 weeks after your first dose.
Oh, okay. Berarti kalau misalnya lu divaksin itu, maksudnya tadi kan lu bilang tenda-tenda, berarti ini kayak just like random places, kayak all over the city, atau kayak is that deket kayak health clinic atau gimana, dan ada berapa banyak tempat gitu?
It's actually like a health center.
I see.
So they kind of like kayak ada health clinic gitu, but they use their parking lot as like this like kind of like like a drive-through thing.
Oh, itu kalau misalnya lu drive-through ya. Kalau misalnya lu
it's pretty neat.
Kalau misalnya lu face to face, lu harus masuk ke health clinicnya buat get vaccinated berarti. I think like si Joe Biden bilang in his first 100 days he wants to give out like 100 million or something vaccines gitu kan, dan kayak kalau misalnya he is able to achieve that, katanya by September Amerika bisa kayak hopefully get herd immunity, which is like that will be super great for America, right? Dan kayak gue nunggu, aduh di Indonesia kapan ya, come on.
I know. Makanya gue juga kayak lumayan kayak same kayak gue. I'm excited for that for America, but I'm also like anxiously waiting buat Indonesia buat vaksin juga kayak roll out gitu.
Iya sih. Dan kalau misalnya habis
Yeah,
your
so-
second vaccination or your boost, your top up itu, what happens after that, Har?
I think yeah, I think that's it. At least for me, that's it. Biasa kalau mereka mau follow up gitu bakal ada kayak consent form. So it's like a research, right? Like in a research, you have the consent form that you need to sign to basically allow them to follow up with you. I don't have that. I mean, I didn't get that. So at least on my side, I assume that it's over once I get the vaccine. So hopefully, it will protect me because again, like it's not 100% effective. So really depends on each person. So but at least I feel more protected than not having the vaccine. Yeah, and encourage people to get vaccinated as well.
Iya sih.
Yeah, I think the issues for everywhere will be like there will be quite a big chunk of people that reject vaccination.
Apalagi di Amerika, kayaknya lebih banyak orang yang nggak percaya sama vaksin ya kayaknya ya.
Yes, the Antifactors. Yes. So I think like some states are like at least the first like phase 1A. Kayak gua ada baca di news gitu kayak some state is as high as 50% healthcare worker who reject the vaccination.
Wow, 50.
So I've seen that article before.
Ooh.
Yeah, and this is like the phase 1A, so like the healthcare worker. So I don't know what message it sends if the healthcare worker themselves refuse the vaccine,
I totally
even though they're the
agree.
one that's treating or helping with the the treatment process of COVID.
Yeah.
It requires a lot of like education, psychoeducation about what vaccination is, what the side effect is, and things like that. Hopefully to increase like more people willingness and actually getting vaccinated.
Iya sih, soalnya kalau misalnya
so that's a public health issue.
Yeah, that's true.
Yeah.
Kalau misalnya nggak semua orang, maksudnya kayak nggak bisa
Yeah.
divaksin juga, we can't reach that herd immunity kan, maksudnya kayak susah nggak sih, kayak you still have to be cautious terus aja gitu kan, kayak that's what's important gitu nggak sih, to reach that like herd immunity, everybody getting like vaccinated and so on. So definitely something that needs to be addressed.
Yeah.
Public health buat semua orang ngerti gitu ya, the
And
importance of
worked
vaccine.
on. Yeah, it always goes back to me, right? Like
Yeah.
always goes back to the individual level, right? Kayak per orang itu kayak at least this is what I do. This is what I do to keep me safe. Me and myself safe. This is what I do to keep me and my community safe. Or hopefully each person are doing their part to keep them and their loved one
Yeah, see.
protected. Yeah, but I understand, right? Like, at least as a psychologist in training, like as a student, I understand how difficult it is to
Yeah.
be socially isolated, for almost a year now. Gua ngerti lah kayak kenapa orang-orang mau ketemu family lah atau mau ketemu teman lah kan, kayak it does get lonely and it
Yeah,
is a
definitely.
difficult time.
People need support.
So there's like that balance of like the public health good thing to do, but then there's also like this like natural drive to keep yourself protected. It's a very natural psychological instinct that you have.
Yaudah Har, thank you banget buat sesi hari ini. You're the coolest. Kayak we get to talk to someone yang udah divaksin. Dan kayak if you kalau misalnya ada yang punya pertanyaan lagi, nanti you guys can comment below. Maybe we'll do a part 2 maybe ya Har ya, setelah kalau misalnya lu udah di boost, lu udah divaksin 2 kali. And if a lot of people wants to ask more questions buat Hardian, just drop it down below. Okay, for now, thank you banget ya Har ya for the time.
Sounds good.
Bye.
Bye. Thanks everyone.